How long does it take to get over anxiety and depression? The simplest way to understand anxiety is as a stress response, also known as fight or flight mode. However, once that threat or stressful moment passes, the anxiety usually disappears. So, if your anxiety is persistent or crops up when there is no apparent reason, you might be wondering, how long does an anxiety disorder last? An anxiety disorder can last anywhere from a few months to many years. Have you considered clinical trials for anxiety? We make it easy for you to participate in a clinical trial for anxiety, and get access to the latest treatments not yet widely available, and be a part of finding a cure. When does anxiety become anxiety disorder? Approximately 31.1% of American adults will develop an anxiety disorder at some time in their lives. Anxiety disorders are generally associated with having constant and excessive fear or worry in everyday life, with an urge to avoid situations connected to this fear. There are several types of anxiety disorders. Generalized anxiety disorder. Constant and excessive worry or stress that interferes with everyday activities. Panic disorder. Recurring, sudden panic attacks, accompanied by physical and psychological distress. Separation anxiety disorder. Extreme fear of separation from a person or fear that something terrible will happen to a loved one. Symptoms. Anxiety can make you feel tense or worried, and you may notice that it heightens your alertness. For example, when you're anxious, you might feel sweaty, your heart might race, and your breathing becomes faster than usual, or you suddenly realize that you've been holding your breath. How long does an anxiety disorder last? There is no set time frame for how long an anxiety disorder is expected to last. It is highly individual. According to one 3-year study, 2 factors for anxiety disorder duration include being in an older age group, having a physical disorder or poor physical functioning, the type of anxiety disorder. Timely diagnosis is important. One of the guidelines for diagnosing generalized anxiety disorder is having severe, persistent anxiety and symptoms for at least 6 months. From the time of diagnosis, an anxiety disorder can last from a few months to many years. What does research indicate? Without any intervention, anxiety disorders can worsen over time and prolong the impact on your everyday life. Anxiety disorders can be long-lasting, but full recovery is also possible. The risk of relapse. Even after recovering from an anxiety disorder, you will still experience anxiousness. However, instead of the persistent symptoms of a disorder, you will feel occasional anxiety that switches on and off in response to stress. Why does an anxiety disorder come back? In response to stopping anxiety medication. It can be tempting to stop medicating your anxiety once you start to feel better. 1/3 of people who suddenly stop taking antidepressants midway through treatment relapse. How to live with anxiety and recover. Finding constructive ways to cope with your anxiety disorder can empower you to return to your usual activities and feel positive about your well-being and relationships. Here are some evidence-based ways to help you live with and recover from anxiety. Exercise and make other lifestyle changes. This may involve taking medications as prescribed, going to appointments, or following up on homework between therapy sessions. Beta blockers can help manage and reduce physical symptoms of anxiety, short-term or as needed to reduce acute anxiety. Research 7 shows that a combination of psychotherapy and medication is a more effective long-term option, compared to just one or the other. The lowdown. Mental health conditions are highly individual, and so it is impossible to predict exactly how long your anxiety disorder will last. Just remember, if you have anxiety that limits your ability to function in everyday life, many different treatment options are available. Some people can experience a full recovery, while others will improve their symptoms and significantly regain their quality of life.